Doctors are quitting healthcare, and it's starting to get scary now because as we take a look around, AI is taking over. Doctors are giving up because they feel like it's mentally draining. They feel like they aren't being compensated with the insurance companies. They also feel like when they put in certain claim, sometimes it takes weeks, months, and years for them to get paid. But not only that, one reviews from any troll can potentially close down a doctor's business. And they feel like they put in so much time and effort and investment, going to college for so many years, doing their internship, residency, only to know that this is happening.
It's like this was the end of the road for me. I put my office up for sale. I am not doing this anymore. Guys, your favorite ranting dentist is back. And what I've come on here to say isn't easy for me, so if I even cry, like, I'm sorry. But guys, like, this was the end of the road for me. You're all smiles and stuff this morning, like things break and stuff, and you get through it. Someone just wrote a 2-star review about me and said that I'm a nice person, but does not return the mother's phone calls after she worked on her and is quick to refer out issues that a general dentist should be able to confidently address. Quick turnaround, and refers out dismisses when things get challenging, which is really funny because first off, I'm not allowed to respond to this because it's HIPAA, so I can't even defend myself on here. This person left a message Thursday night. My office is closed on Thursdays. And before I left Wednesday night, I put a voicemail up saying I wasn't going to be in the office Friday. I was not here. And it says if it's an emergency, you call my cell phone. This person left a message Thursday night. Obviously, office is closed. I could not call you back. Office was closed Friday, and I was not here over the weekend. So this morning, when I'm short-staffed, you're going to leave a 2-star review because I didn't call your mother back right away and say that I worked on your mom and I didn't. You want the records? Last time I saw your mother was in February. And you want to say I didn't do things in my scope? I've taken out teeth on your mom. I've done root canals. But yet I'm just a shitty general dentist, right, who just refers things and can't take complicated things. This is you're allowed to write a review on my business, on my livelihood, and you're not even talking real, like you're lying. And they're allowed to write that on my livelihood. After I bust my ass to help people and bend over fucking backwards, I don't even get paid half the time. This was it for me, you guys. I put my office up for sale, and I am done. I am done getting beat on about people's insurance. I am done for not doing everything perfectly. It clearly said if it was an emergency, like I put my cell phone on there. You could have called my cell phone. And guess what? I know it worked because some asshole called me on Saturday to talk about their insurance when it clearly says only to call for emergencies. I have had it. I am done. I am so far done. It is well past done. When you can't find trustworthy dentists in the future or people who care, this is why. Because the rest of us got berated to shit and we're out. I'm done.
They put in so much work, so much hours only to get this, Not only that, they will speak on someone is always trying to sue them for any little thing, whether that be, if you're misdiagnosed, then that's another story. And it's already hard because the insurance companies aren't paying them. And it's just a lot of things that is going on. They are not being respected anymore because they feel like, in most cases, they feel like they spend more time with the insurance companies trying to get their claim back and less time with a customer. And sometimes the work that they put in over the years, they have not been compensated for it. So yes, after a while, it does get draining. I see the same thing too for nurses. I created a video speak on nurses, y'all, where nurses are going broke. They feel like they have been overworked. They don't feel appreciated anymore. And there's just a lot of things going on in healthcare. And I would never, ever think in my life that healthcare would be targeted like this.
So the girl in that video actually quit medical school after 3 years. And as a doctor, I can tell you flat out, medical school was one of the hardest things I had to do. See, college wasn't as hard as medical school, not by a long shot. Medical school was extremely difficult. And full disclosure, during medical school, I actually suffered from major depression. I was completely depressed for maybe half of my medical school career.
I am convinced at this point that our healthcare system is set up in such a way to just be frustrating for patients and providers and to ensure that it is as difficult as possible to provide medical care. I have a new denial from one of my patients' insurance regarding a medicine that I prescribed, and it just says the second preferred agent is there's no evidence of treatment failure, intolerance, or contraindication to this other agent. I went to medical school and residency and fellowship, and I learned about these medicines, and I frankly feel like I know what I'm talking about, and it frustrates the absolute hell out of me that an insurance company gets to dictate what is or isn't okay for my patient. And that this is legal. To me, this is the practice of medicine that they are doing. So that's all I want to say.
And I'm quitting medicine, at least for now. I've gotten such mixed reactions about this. Some people hate the idea. They think it's ridiculous to take any time for yourself because in this field, you're taught to give everything when you're in training. So work becomes your whole life. The medical field attracts a lot of overachievers, also a lot of ego. I'm honestly just burned out by the politics of a system that rewards cutthroat ego more than it rewards honest hard work.
It's sad. It's really sad that these things are happening, but we have to be awakened.
So this is why your doctor is about to quit. Back in the 80s, you can see that most doctors were self-employed, almost 20%. See? And now, in the 2020s, we're up to 60 to almost 80% of physicians employed by the hospital or corporate system. Next, everyone's favorite is insurance denials, an inhibition to make payments for the work done. So you can see there was almost nothing tracked back in the 80s, almost zero denials, even though there were, and now up to almost, look right here, almost 20%, 1 in 5 claims are denied nowadays. This is another thing that's crazy. Even physicians who actually get claims approved, a lot of those claims that are approved, almost up to 10% at times are unpaid, even if they're owed the payment. Next is malpractice. Malpractice has gone up significantly in the last several decades, almost up to 700 suits. Good news, of last decade it dropped a little bit, but the ability to practice medicine without fear of litigation has also gone down. Here is higher. Ooh. And our malpractice premiums have also increased precipitously as well. So what does all this mean? Well, practicing medicine comes with inherent stress, right? Life and death. There's a lot to learn, a lot to study. It takes a lot of hours. Patients are going through difficult situations, right? That is all part of, nothing's new there, right? That's the cost thing, right? But there's also a lot of value we get. We get to connect with patients in their most valuable moments. They come to us when they need like a learned friend or a trusted resource so we can help them in their desperate times. We can cure and help cure disease. We can provide care. We can comfort. There's a great lifestyle that comes with it. There's a good earning potential that comes with it, right? All of these things have always been the trade-offs, right? All of the value matches the stress. Because I'm going to make the argument that has really not that much to do with reimbursement or payment, even though it does have to do with being able to like pay staff, et cetera, cover your expenses. But what's gone down is right here. It is autonomy. Because the gap between the value derived from practicing medicine and the stress that it causes is covered by autonomy, right? We're willing to step in the gap. We're willing to do the things we need to do when we have the autonomy to make the decisions to do those things. But look, over the last several decades, when our autonomy gap was only a 3 minimally, but then we had managed care come in the 90s, and then EHR came along in the payer rules, and EHR, the rules that we have to follow to maintain the guidelines of this has only increased our burden and decreased our autonomy. And now burnout is almost at 63%. Because the autonomy that we have to practice medicine is so low. So forget burnout. It's not having any control or autonomy. That's the problem. That's why your physician's going to quit.
Silent quitting. Have you guys heard about this? It's been in the news and been all over the media, but it's this idea where people are not going to go above and beyond in their jobs anymore and are just going to do what's bare minimum required to get to the day. The idea has been getting a lot of criticism in the media, accusing people of being lazy and not having the work ethic. Now, let me tell you, as a primary care physician, people's jobs are literally killing them. Let me ask you some questions. How does your job treat you when you need time off? How many of you need to use your vacation time to do very basic things to take care of yourself, like go to doctor's appointments, take your children to doctor's appointments? How many of you work more than 40 hours a week? How many of you don't have a window in your office? These things I mentioned are virtually unheard of in other countries where they have a better work-life balance and they have better physical and mental health. It's like deeply embedded in American culture to just work yourself to death. And then to add insult to injury, guess who's responsible for your crappy health insurance policy? Your employer. So your employer controls the majority of your time in your life. And then when you get sick and you get denied coverage and the runaround and thrown into the system, that's your employer who chose that policy for you. There have been countless times where I've really wanted patients to do some physical therapy, maybe go to some health classes, but they can't. They literally cannot get time off work. So if you're in a job where there's no room for advancement, where hard work is punished with more work, then you know what? Do what you're paid for. Don't sacrifice your physical and mental health for a job.
So here's my take on this, y'all. At the end of the day, we all need doctors. Like for me, I would always want to speak to a doctor, not no AI. I don't want to speak to AI to tell me what I need to do, because at the end of the day, AI is set up like Google. I feel like it's all these information, this knowledge-based information, and as you input your prompt, it'll tell you exactly what you need. It's not going to be 100% right. Nevertheless, I want a human being to look at me and to talk to me. I mean, I don't know if this is going to eventually fade out, whereas we're not using doctors anymore. But, you know, I want to say I take my hats off to all doctors and nurses, because healthcare is what truly helps us. You know, I remember when my baby was born, all of my babies, you know, I had a great experience. You know, when it comes down to delivering babies and stuff like that, are they going to use AI for those things? So, you know, it gets a little scary here and there. We're all going to need nurses. We're going to need dental doctors, medical doctors, what you call a gynecologist, doctor, whatever that is. We're gonna need doctors. So y'all, let's respect our health professional, please. We want to keep them in. We do not want AI to look after us when it comes down to certain things, because one thing, AI does not have heart. They don't have love. They don't have compassion, unlike human beings. And I know you're probably going to say, well, people are mean nowadays, but let's, you know, doctors, they have a lot of things on their shoulder. They have to deal with patients and nurses and everybody else, and right, and they have to document, right, and they have so much things on their plate, so much hats, you know. So let's just give our gratitude to them, right? Let's be kind. You know, think about it, right? Your job, if you're working a 9-to-5 job and you know that it's not easy dealing with customers, what do you think for doctors? The best thing that we can do, let's give health professionals some grace. Let us pray for them so they can go on and to continue doing their jobs. You know, they're not perfect people. They deal with different people from day to day. We know that life isn't easy, but at the end of the day, let us pray for them. Let us get through this, all right? We're in a season now. We're in a crisis right now. So much things is happening. People are going broke. People are going homeless. You know, no one can afford food anymore. It's just, this economy is just high. Inflation is high, not to mention healthcare. We do not want to get rid of our doctors, nurses, medical assistants, and everyone else that is in healthcare. We want to give them some grace. We want to put a respect on their names. And I want to hear your thoughts on this video. Let's talk about it, y'all, because at the end of the day, we can't, God put us here on this earth for one reason, not for AI to take it over. We should have dominion over everything. And that's how I feel. I want to know your thoughts on this. And I know not everyone will agree with me. That's okay. We can be here to agree to disagree. I'm okay. Regardless of how you feel, a girl still over here, I still love you. So may God bless you. May God restore you, and be safe out there. Let's talk about it.